Hey everyone, this is Dr. Echols again. So nice to be back with you today. And we have the lovely and incomparable Miss Corrina here to help us with some of our videos today. Thought we might talk a little bit about the neck, since that's a problem that so many people have. I get this, a lot in my clinic. A lot of people have neck problems either from, either old injuries like automobile accidents, or they fell off their horse, or a lot of times it's sports injuries. Sometimes it's just sitting at the computer too long that they have, neck problems. So a lot of times people will get neck problems and it'll radiate down into the shoulder, or if it gets even worse, it can radiate all the way down into the arm or even cause numbness and tingling in the hands. And that really needs to be evaluated by a competent professional to be able to discern whether the problem's coming from your neck. It could be an entrapment here in the shoulder. It could even be a problem in the elbow or in the wrist, such as carpal tunnel syndrome. And we've had a lot of patients who their neurologist thought they had carpal tunnel syndrome, and they did surgery on their wrist, and then there was no improvement at all. And then later on, we found out that the problem was actually in their neck all along. So it's a good idea to get that checked out pretty carefully before you have any kind of surgical situation going on. It's also important to find out whether there's a disc problem in the neck. And when I say disc, if you picture the spine, there's little vertebra, little bones in the spine, and between those vertebrae, between them, is like a little shock absorber. We call it a disc. And in that disc, it's like a jelly donut. There's a hard kind of ring around the outside, but on the inside, there's this juicy jelly kind of stuff. It's called the Nucleus Pulposus. And sometimes, due to stress or accident or injury, that hard outer ring can kind of break open, kind of like you took a bite out of the donut, and that jelly's going to push out of the backside. And when that happens, it can impinge or hit on one of the nerves that come out of the neck. And when that happens, you're going to be in a lot of pain. I've had herniated discs in my neck from my old paragliding years that I used to jump off mountains and do crazy things like that. And I know how bad it hurts. It's not fun at all. And when that happens, they'll normally get the problem in the shoulder. As a matter of fact, 10 minutes ago, I was working on a guy who was complaining of problems in his shoulder, but really the problem was up in his neck area. And it's normal to think that that the problem is in the shoulder because that's where it hurts. I mean, it hurts right there, but that doesn't necessarily mean that that's where the problem is. Many of you have heard me say it before. You step on a dog's tail, it's the other end that barks. So you can't always tell by where the pain is if that's where the problem is. So I'll just run you through a couple of things that I do to help differentiate between maybe a shoulder problem and a neck problem. And Corrina confessed to me the other day that she had been having a few neck issues, so maybe we'll get lucky and something will turn up. So we'll get you to lay down on the table and just check things out. Very good. Before we get started, you said that was kind of bothering you the other day. Did you have any kind of accident, or did it just wake up that way?
No, I just kind of woke up that way, I guess.
Okay. And this is a great time to mention this. A lot of times people say to me, "Oh, I wish I had a nickel for every time I've heard this. Oh, I slept on it wrong. I just slept on it wrong and I woke up and now it's just killing me over here." It's pretty hard to sleep on your neck wrong. We all look for explanations in life about why things are the way they are. And that's a real good one to come up with. Oh, I went to bed fine and I woke up and my neck hurts, so I must have slept on it wrong. Well, oftentimes that's really not the case. Oftentimes what we find is that person actually has a gallbladder problem. And they might have eaten something a little bit fatty that night. There's a nerve that runs, this is the gallbladder, it's right under the right side here. There's a nerve called the Phrenic Nerve. It runs right up through the spine and it goes up here into the neck, and it also in this right side. So people will get neck pain and they'll get pain right back in here in this part of the shoulder and in their neck. And that's often a gallbladder issue. And if you ever have any doubts about whether that is, you could just reach kind of underneath and push on that gallbladder. And if it's tender right there, you know that, you may be having a gallbladder problem. If you're not sure, touch on the other side and push under there. One, you'll say, oh, that doesn't hurt at all. And this one, oh, that's pretty tender. In that case, we probably need to get some supplements to help clean out that gallbladder. Don't run to your doctor and have him take it out. That's a big mistake. You'll end up getting osteoporosis and all other kinds of problems as a result of that. So just get that cleaned out. There's some great products out on the market today that help with gallbladders and getting that bile flowing freely. It'll also really help your digestion. If you know somebody who burps all the time, they're always burping, that's usually a gallbladder problem as well. But this video is not about gallbladders, it's about necks, but I did want you to know that oftentimes neck problems can be caused by a gallbladder problem. So let's do a few muscle tests. When we do muscle tests, they're really wonderful tools for helping us locate the problem. You know, the problem is not the muscle itself being weak, although that can be a problem, but they're really there just to guide us to where the problem is. And I'll show you what we mean. So first thing I'm going to have you do, Ms. Corrina, this is testing the posterior deltoid. And it doesn't matter about the names of these. I'm just kind of throwing them out there in case you're interested, but it doesn't really matter. But push back like that real hard for me. And that muscle locks in, it's pretty strong. Now on this one, this is testing the tricep. I want you to push down this way for me, push down. And that is real strong too. And the first muscle that we tested, this one, posterior deltoid, corresponds to the 5th cervical vertebra right here in the neck. Okay? C6 nerve root. Now here, when she pushed down, we tested the tricep muscle, which is right here in the back of the arm, and that corresponds to the C7 nerve root. Both of hers are fine. The C8 nerve root we test by the fingers. I want you to push out for me real hard with your fingers, and that tests pretty good. Oftentimes, if this is weak, she won't be able to hold a finger. It'll just be flopping around in the breeze like that. So those check pretty good. Now let's go ahead and check, and I'll see if I can do it on this side of the table. This side, I'm going to have you push up for me. And that one works really good. And then push down here, and that one tests good. And then open and push down. Out. Okay. So in this case, we know that it's not a cervical disc problem. The guy that I treated just before this, it was. So I want to show you what that would look like if it was a cervical problem. So let's just use this, and let's just say that when I pushed this arm, it was weak. It was very weak, and boom, it goes weak like this. What I would then have the patient do, this is a great way to discern whether, which way the disc is herniated, which way it needs to be adjusted, and that kind of thing. You would turn your head this way, all the way, and then you would lean it backwards for me. Then we would retest the muscle. And this time when we test it, it's really strong. So that means that turning her head in that position has moved that nerve off of the, moved that disc off of the nerve root, and we know that that's the position we need to be adjusted in. So we would come around to this side of the table here, and since it is the C5 nerve root, we would just gently make a little adjustment right there. And felt so good, yeah. And it normally is a really big relief. I mean, if you've got somebody stepping on your toe and they get off your toe, it's usually a pretty big relief. So it's the same thing with this. I mean, if you've got a nerve that's really being irritated in there and you can move that nerve off of the disc, it's usually a big relief, and the people are usually big fans once that happens. But these disc problems are significant because this is what people go to have surgery for. And this kind of treatment, I think, should always be considered as a primary option. Who wants to have their neck cut open? And what the results you get are the results you're kind of stuck with. So I think this is always a good conservative method for handling these kind of problems. Sometimes these discs will stay in place with just a few adjustments. Other times they're chronic. They've been there a long time, and it's going to take a little bit of work and time and patience, as it did with me to get my neck corrected. It took me about a year. I had 3 herniated discs in my neck, and it was very painful. And I have to admit there was times where I, even contemplated having surgery, but that would have been pretty hard for me to take off my practice for months at a time and do all this. So I just elected just to kind of stick it out, and I'm really glad I did because now, I'm doing fine with that. So anyway, that kind of shows how we go about doing that. I'm going to go ahead and get the other side of your neck adjusted just so that doesn't feel jealous. And one of the ways I can do that is I forgot to bring one thing I need, but just go ahead and give me some pressure here. We're going to check a strong muscle here. She's pretty strong. And then oftentimes when we touch an area that is affected, that muscle will go weak. So here we have strong muscle. And when we touch your atlas up here, it goes weak. So we'll turn your head this way. Strong and then strong. So we are going to run over here. Have you been having any headaches at all?
No, not really.
That's good. So just a little adjustment right there.
Oh my God.
Yeah, and that'll help that. Don't try this at home, but this is just an educational video to help you to learn what some of the benefits that you can get through conservative chiropractic care are. And I really hope this helps you figure out, what this problem is a disc problem. This is the way we can figure it out or not. So anyway, if my website is jeffechols.com, please go check it out. If there's anything I can do to ever help you, please feel free to call me or email me, and we'll see if we can get you some help. Thank you so much for watching. Keep an eye out for further videos.